I'm Dr. Cyrus, Contractor, MD Pediatrics, DCH, DNB, and in the pediatric department, I'm the head of department. We mainly specialize in newborn intensive care. That is the USP of Breach Candy Hospital. We've got an excellent gynec unit, obstetric unit, and a lot of high-risk deliveries. And our NICU is probably one of the best in Mumbai, if not in India. Adequate nurses and basically the state-of-the-art equipment and enough doctors. So we take care of a lot of high-risk newborn babies, right from the very preterm babies, 24 weeks they are born, and right up till other bigger babies with other difficulties, including surgical. So we have pediatric surgeons also involved in the hospital. So basically I finished my MD and then went to Australia to specialize in newborn intensive care in Sydney. I was there for about 2 years, came back in 1994. At that time there was no NICU in Breach Candy Hospital. So I still remember the days when a baby who was born high risk here would be picked up and transferred to another place. So we used to do that, and then Dr. Balsekar, who's our senior doctor, and me decided that it's high time we have an NICU here. We can't afford to keep shifting babies. So we started with a very tiny NICU, 2-3 bedded NICU to begin with in about 95. And then we slowly have built up, and we've added on as time has gone by, and obviously become better and more proficient at it. The whole team itself, the obstetric team, from the nurses, I think the basic USP of this hospital is exceptionally good nursing. I think that should never be forgotten, because it's the nurses who are all the time with the patients, whether it's the mother who's delivering or later on in the NICU, when we come, we take rounds, we give orders, etc. But it's the nurses who are there all the time with the mothers. They actually handhold them through the whole journey. So there are babies who stay here for as long as 3 months sometimes, who are born 3 months early. So they have to be sort of taken care of and helped with, emotional support, which is also an amazing part of being a medical person. Whether you're a doctor or whether you're a nurse, I think emotional support is very important, especially these mothers who are very vulnerable right now. Soon after delivering, they don't expect to deliver, it just suddenly happens, and they've delivered a small baby who's lying in front of them, 600, 700 grams. They can't even fathom how and what is going to happen. And so slowly that whole journey begins, and they start off. So because we believe that we must speak to patients all the time. We have to tell them exactly what's happening, and we have to give them the adequate support, and our nurses are very, very good at that as well. So I think this talking makes a big difference, and being empathetic towards them, and that kind of stuff. So I think it's just the whole experience. Also when they come in, they deliver, the obstetricians are excellent. Then we have excellent anesthesia support, so for epidural anesthesia. So just a complete painless kind of childbirth, which is very important for mothers also. And then just the way they are taken care of afterwards. If the mothers have a problem, we have enough specialists here to come in and look after the mothers as well. We have an adult ICU. There's sometimes mothers who end up with a massive complication, either during, after they come, sometimes seizing, epilepsy, having pre-eclampsia, high blood pressure, they have a seizure, baby has to come out immediately. Then they are shifted to the ICU. So all the ancillary support is also there, which makes it a very good place to deliver. We've had full support of the management and of everybody here as far as the newborn intensive care is concerned. We share an excellent rapport with all the obstetricians who come here, and they themselves realize that this is the place to bring their high-risk patients in case where they expect that the baby may end up, landing up in the NICU. I think another very important aspect which people don't realize is to have good ICU outcomes, you need to spend money. So I think both, it's parents who've given enough support to us as well as the management and all, which is why the experience here has been probably the best as compared to all the other hospitals wherever I have worked.